You are watching a special edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. My first guest is Dr. John Willardsen. Dr. Willardsen is the director of the Willardsen Aesthetic Institute. He's here today to discuss who's a candidate for dental implants. Dr. Willardsen, welcome back to the program.
Thanks, Randy. Thanks for having me here today.
Now, we've had you on the program several times.
Yes,
and you promised all new stuff in regard to dental implants.
Absolutely.
Okay, good. Well, let's talk about some of the changes you've seen in the last 10 years, 15 years with dental implants.
Okay. Changes, as far as the implant fixtures themselves, there haven't been a lot of changes. You're seeing a lot of marketing and hype about mini implants.
Right, I've seen that.
And there's a lot of general dentists out there who are marketing and pushing mini implants.
I've been told they're pretty good.
Well, there isn't a purpose for mini implants in my practice.
Okay.
Mini implants are temporary implants. They are used to put temporaries on. They're not used for long-term use.
Now, we have one of your patients, Mrs. Bennett. Give us a bit of a setup before we bring her on.
Okay, Krista came to my office. Apparently she had seen multiple dentists and had gotten second opinions on her situation. When I saw her, her mouth was in a situation that needed some help, and so as we can see here in the before photo, she was missing teeth. She had some old dental restorations that needed to be replaced.
Like bridges, partials?
She was wearing, I believe, a partial, actually upper and lower partials, and she wanted something fixed. She wanted something that did not come in and out. So basically what we did was we started from scratch. We came in and we did, the first thing we like to do is what's called the diagnostic wax up, and we use it's called the Smile Catalog, and we use this to determine what are we trying to achieve when we're all done. Okay. And the Smile Catalog is nice because it's a way that I can communicate with the patient and then also communicate with the lab what the patient and I have agreed upon. And that's exactly what we did with Krista. Was we determined from the Smile Catalog what we wanted her case to look like. I liken it to an architectural blueprint. I mean, when you build a house, you have to know where you're headed. You've got to have a foundation. You've got to have some sort of a idea as to where you're headed. And every single case is different. Every mouth is different. We've got different situations going on with every single patient. So I have to create a blueprint on every patient, and that's exactly what we did with Krista. We started with the blueprint, which was the diagnostic wax up, and then from there, it's kind of like working backwards. I know where I'm headed, and so with the wax up, I was able to achieve that goal. And in the end, it turned out beautiful. I mean, we literally restored all of her teeth and replaced the teeth that were missing with dental implants, and gave her a smile that I think she can be proud of.